Hi, my name is Regina Chincio Kwong, or Dr. CK, and I'm with the Orange County Healthcare Agency. First and foremost, I want to thank all of you for volunteering to help out at our vaccination pods. We need all of your help and support to help vaccinate 3.2 million before July 4th, so thank you again for helping us vaccinate our community. So first thing we want you to do before you prepare for showing up at any one of our vaccination pods is to review the material that was sent to you via email. These are important resources from the CDC that are required for you to review before you vaccinate. Today we'll go over safe vaccination methods, and we will demonstrate how to prepare and mix Pfizer vaccine. You may have other vaccines available at your dispensing pods, but for today we'll just go over Pfizer, and please review the material for the other vaccine that you have available at your site. A pod is a point of dispensing site typically used in emergency situations to dispense vaccinations to a mass amount of patients. Here in Orange County, we have several types. We have a super pod, which typically can vaccinate over 7,000 in one given day, or we have mobile pod or pop-up pods that can accommodate anywhere from 200 to 500 patients in one day. Each pod typically has a field manual guide that's available for the pod site director as well as the supervisors. But today we will review the very basics of what you need to know for your vaccination station. When you are at your pod site, we want you to be safe. And at your pod site, you'll be given a face shield, a surgical mask, or an N95 mask. We do require that you use one of the masks that's made available to you as well as the face shield to keep you safe as well as your patient safe. You will also be provided gloves as long as there's no glove shortage in the county. At each vaccination station, you will have alcohol hand sanitizer as well as sanitation wipes to keep your area clean. Typically in routine vaccination practice, gloves are actually not required. As long as you do not touch the vaccination site, you can actually just use your hands, but you do have to use hand sanitizer between each patient. If you choose to use gloves and there is a massive glove shortage, you can reuse them, but you must use hand sanitizer between each use and discard the gloves after 6 patients. If your glove becomes torn or soiled or gets in contact with bodily fluid, you are asked to remove those gloves and change gloves. If you have a Chex pad or another pad that's provided to you, we do recommend that you keep your surface clean. Otherwise, you can wipe your table surface with sanitation wipes. At your table, you will see that you have a vaccination checklist. This is provided by the CDC, and it's a requirement for you to go over with each of your patients to verify they have no questions. You will also see a guide from the CDC about appropriate methods and anatomy of how to deliver intramuscular injection. If you are handling a vaccine at your station that requires mixing, you will be given step-by-step instructions of how to handle and mix that vaccine. Also at your station, you may find that you have a vaccine log sheet. If this is provided, it helps you document what vial was opened, how many doses you actually were able to pull out of vial, and what time you mixed your dose. Also at your table, you will find patient vaccination record cards. These are filled out by your station and given to the patient for their personal record.
Hi, my name is Kevin Mai. I'm the pharmacy coordinator for OCHCA University Pod. Today I'm going to be demonstrating how we prepare the Pfizer vaccine before administration. So before you do that, you want to make sure that you have the Pfizer vaccine with the purple top and some diluent, which is sodium chloride, with the pink top. You want to sanitize your hands with the hand sanitizer with alcohol base, and you want to prepare some alcohol swabs and a 3 milliliter syringe for mixing. Once that's ready, you will pop off the tops, which I've already done over here. And before you start mixing, the vaccine has to be at room temperature, and it needs to be inverted 10 times. Do not shake the vaccine, otherwise it will no longer be viable. So once we invert it 10 times, we can get started. 7, 8, 9, 10. So once the vaccine has been inverted, grab an alcohol swab and go ahead and clean the tops of both vials. Once that's done, grab your 3 cc syringe and you'll draw up 1.8 milliliters of sodium chloride. Be careful of having large bubbles, otherwise then we wouldn't have enough diluent inside the vaccine. Okay. If you do have any bubbles that pop up, you can actually flick the syringe a little bit to get rid of them. Once you've drawn 1.8, we'll go into the vaccine here. Go ahead and invert that up. You'll be injecting 1.8 milliliters of sodium chloride into the vaccine and then withdrawing 1.8 of air. Once that's done, you can either safely recap the syringe or toss it directly into a sharps container. After we've mixed the Pfizer vial, we need to invert it 10 more times. Again, do not shake and be very gentle. 9, 10, okay? Once that's done, the vaccine is prepared for us to draw syringes from. Now the dose of the Pfizer vaccine is 0.3 milliliters. The vials, when reconstituted, is a 2 milliliter vial. So we can reliably get 6 doses from it. Sometimes we are able to get 7, and I'm going to demonstrate how we pull some doses from this vial right now. We have 2 types of needles. We have the Vanishing Point, which is a 1 cc, 1 inch, 25 gauge needle. We also have disposable syringes without needles and the accompanying needles that are 1.5 inches long. So I have a Vanishing Point needle here. What you want to do before you draw is you want to make sure that we're putting in the same amount of air as we're drawing out vaccine. So you want to put in 0.3 mLs of air before you draw out 0.3 mLs of the vaccine. Okay. Make sure that you don't have bubbles, but also be very gentle with the syringe. Once the vaccine has been drawn, recap, and now this is ready for administration. At each of your stations, you'll also have a dose tracker. Once you draw the medication, you'll be able to initial how many doses you retrieved from that vial. So the Pfizer vaccine has 2 milliliters and each dose is 0.3 mLs. You can reliably get 6 doses, sometimes 7. If you are getting 8 doses, immediately notify a pharmacy coordinator so that we can address the issue. So at each station, we'll also have a guide to the different sizes of your needles. So we want to make sure that patients who are more frail or patients who have blood thinners on board, we want to make sure that we use the thinner needles, so the 25 gauge and 1 inch long. At each station, you should have a tray that you can place your pre-filled syringes into. Make sure that the tray is marked with some sort of identifier for which vaccine you have and what lot number. On each station, you may have an area of the station where we will be drawing up the syringes. Also at each station, we will have some tape to separate the area that we'll be mixing and drawing up the vaccines to where the vaccinators will be actually administering. This is just to make sure that we don't confuse any of the pre-filled syringes with empty material.
At your vaccine station, you'll have different sizes of needles. This guide will help provide you information on how to select a needle size, especially dependent on the patient's size. For the most part, a 1 inch needle can be used for females and males. However, if a female is over 200 pounds or a male is over 260 pounds, you really want to consider a 1.5 inch needle. If someone is on blood thinners, remember that it will be helpful to use a smaller gauge needle, like a 25 gauge, to minimize the bruising and bleeding. You can still use a 23 gauge needle, just warn the patient that they may have more bleeding and bruising. At your site, you may find you have a retractable needle. Some of you may not be as familiar with this. The retractable needle has a spring that retracts the needle upon full injection of the vaccine. I will demonstrate this on this fake arm. If you've never used one of these before, you may want to ask your supervisor to practice with one before you start using it on a patient. So remember, when you are injecting a patient, you want to make sure that the site you use is clean with an alcohol swab. allow the area to air dry. You can either pinch the tissue to allow the tissue to gather, or you can just inject directly. You want to inject the needle with the needle entering the skin at 90 degrees when you're injecting intramuscularly. The needle will actually retract. Even though you do not see the needle, it is not in the patient's arm, it's actually in the syringe. And remember, immediately after using a syringe, whether or not it is vanishing point, please immediately discard it in a sharps container. You do not want your needle to touch the table or a tray, because you don't want to contaminate your area or get confused. Some needles will have a safety cap. And once you inject the patient, technically you can put the safety on. But again, we do not want this needle to be placed on the table. We want this needle to directly go into sharps container. Before injecting, you want to make sure you understand your anatomy and identify the landmarks. For a deltoid injection, you want to identify the chromion, which is the bony section of your shoulder. And then you want to go 2 to 3 finger widths below. In this area, you'll find the belly of the deltoid muscle. You want to wipe the area with an alcohol swab. You can either pinch the skin or leave it alone and inject into the belly of the deltoid. You do not want to inject too low or too high, nor do you want to inject in front or behind. Remember, you do have this guide in front of you to reference to make sure you inject in the appropriate location. After vaccinating the patient, remember to document on the Athena app. You want to document the location, the type of medication that was administered, and the dose that was administered. And then you also want to make sure you press done or complete after documenting that in the system. By pressing done or complete, you will save this into the patient's record. You will also have a vaccination record card that you must complete. With this card, you must place the patient's last name, their first name, and their date of birth. Also, you must indicate if this is their first or second COVID-19 dose. Write down the product name, the manufacturer, as well as the lot number, the date of administration, as well as the clinic site or the pod site. On the back, if this is the first dose that you're administering, you want to make sure you write down the recommended date for the second dose. In the case of Pfizer, the recommended second date is 21 days from the first date. For Moderna, the second date is recommended to be 28 days. Once this is complete, you can direct the patient to the observation area to be monitored for 15 to 30 minutes. Also remind the patient that they can review the emergency use authorization on their app, or they can get a hard copy of the emergency use authorization of the vaccine they just received. Also remind the patient that if they develop any signs or symptoms after receiving the vaccine, in the days after receiving it, that they can place this on the app and use the app to directly notify VAERS. They can also notify VAERS directly, as noted on the back of this card, or they can use another app called vSafe. All these are methods to notify the vaccine companies of adverse reactions that patients may be experiencing. They should also notify their primary care physician if they're experiencing any symptoms. Thank you for volunteering to vaccinate 3.2 million residents of Orange County. We are excited to open up our county and be independent of COVID.